Hello and welcome to MedEvidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loeyball, and this week we're talking about what happens when our out-of-control chemicals cut our ability to regulate our mood. Bipolar disorder on the knife's edge of emotion. When I cook pasta, I need to ask my wife to taste it for doneness. She tastes it and invariably advises 30 more seconds, which might seem minor but is actually critical. Too little cooking time results in tough, chalky pasta that fails to twirl on a fork. Too much cook time and it becomes gummy and gross. To get it al dente, which is Italian for to the tooth, and perfect, I have to balance heat, saltiness, pasta thickness, and my own lack of skill. Well, I'll remind you, I have to ask her every time. Every time. The way our brain determines mood is much more complex, but there are similar problems if things swing too far one way or the other. Bipolar disorder is a good example of what happens when you don't have a professional chef wife helping regulate things. Bipolar disorder is a common condition, affecting around 1 in 25 people. Even though it's a leading cause of disability worldwide, the condition is often initially misdiagnosed. On top of this, bipolar disorder is heavily stigmatized, and many sufferers are unaware they have the disorder. 70% of cases have an onset between ages of 15 and 24. The risks of developing a psychological disorder like bipolar disorder are complex and hard to boil down. This is because the brain is a complex spaghetti of neurons sprinkled with neurochemicals, proteins, support cells, immune cells, and more. Research shows that bipolar disorder is caused by a complex interaction of genetics, for bipolar disorder runs in families, epigenetics, which are changes to gene expression, environmental effects, including childhood circumstances, stress, employment, and so on, and brain chemicals, the balance of signaling and regulatory molecules, proteins, immune cells, and whatnot in the brain. Bipolar disorder also tends to be present with other medical conditions, including heart disease, high blood pressure, obesity, metabolic syndrome, diabetes, anxiety, and substance abuse disorders. For some people, an unfortunate combination of risks can spill over into bipolar disorder. Bipolar disorder is defined by cyclic swings of mood, from episodes of manic mood elevation to debilitating depression. These are two sides of the same corzette with dramatically different flavors. Manic episode, which is increased energy and activity that causes impairment, including risky behavior and not sleeping. Subsyndromal hypomanic, that's almost manic episodes, increased energy and activity without impairing everyday activities. Cycling or mixed, which is manic-like and depressive symptoms occurring in rapid succession or simultaneously, so you might be sleepless, impulsive, and distressed at the same time. Euthymia, which is a fancy name for relatively stable, it's the person's baseline. Subsyndromal depressive, which is almost major depressive episodes, but without impairing everyday activities. And a major depressive episode, which is an intense period of at least 2 weeks of sadness, despair, and or loss of interest in once enjoyable activities, along with other symptoms. The dominant pole of bipolar disorder is depression, with significantly more time spent in depressive episodes than in elevated states. Major depressive episodes are the primary cause of suffering, also called morbidity, and depression can be treatment-resistant and occasionally fatal. Bipolar disorder holds the highest suicide risks of any major psychological disorder, up to 60 times that of the general population. Both manic episodes and major depressive episodes can be medical emergencies and may require hospitalization. People experiencing an episode should talk to a qualified medical professional. Bipolar disorder is a psychological disorder linked to physical changes in the body and brain. Scientists do not fully understand the underlying processes, but just like the risk factors, it is an interaction between genetic, epigenetic, environmental, and neurochemical factors. Researchers have found some links between bipolar disorder and increased epigenetic aging, inflammation, mitochondrial dysfunction outside of the brain, and definite changes to connection signaling molecules and regulatory chemicals inside of the brain. These changes inside the brain mix together into changes with the brain's reward system. The brain's reward system motivates us to do things and is critical for our mood and function in the world. Brain chemicals like dopamine and serotonin are released after rewarding experiences like eating, sex, and drug use. These are the major brain chemicals targeted by bipolar medications. Medications for acute manic episodes generally aim to lower reward chemical concentrations, and those prescribed for major depressive episodes aim to raise chemical levels. This has resulted in several medications approved for acute mania, but can be problematic when applied to major depressive disorder, as cooking too hot can be addictive and dangerous. Using general antidepressants for bipolar disorder is controversial, as there is no conclusive evidence of their efficacy and there's a chance of triggering a manic episode. There are some bipolar-specific medications that target depression, though a significant number of people have major depressive episodes that are resistant to treatment, necessitating new targets. An exciting area of research for bipolar disorder is to regulate the body's own release of reward chemicals. This includes new medications that target brain receptors that are suspected to be responsible for bipolar disorder. The thinking is that by changing the body's own dopamine release systems, medications may be able to avoid the addictive and mania-inducing effects while raising the mood back to a stable, euthymic, or normal state. Bipolar disorder might be a disease on the knife's edge between mania and depression, but clinical trials are hoping to take this disease to the tooth. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our descriptions are linked in the podcast description below. You can also visit our website at medevidence.com. MedEvidence helps answer the question of who can you trust for medical information. The MedEvidence platform provides valuable information about many medical issues and the insights of evidence-based medicine. MedEvidence educates audiences through engaging and entertaining magazines, podcasts, videos, articles, and presentations. We strive to bring together diverse voices of top-level medical professionals, researchers, and experts to provide unique and engaging content that uncovers the truth behind the data. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll see you next week.